Hi, everyone. This is the Healthy Roots series. We have myself, Mark Hawass, and Dr. Crystal, naturopathic doctor here, and we're on week or session number 10. And today we're going to talk about moving in alignment, which is basically posture that we were going to focus on today. So, welcome, Crystal. Tell us about what we're going to talk about today.
Yeah, exactly. So you're going to see some parallels for what we discussed in the previous week. And part of the parallel is the quote that we have here that movement is medicine for creating change in a person's physical, emotional, and mental states. And I think this relates to posture as well, because we know that when people have a stooped over posture, their head is down, they're making eye contact with the ground, not with with in your own eyes, um, or you're walking in a very funny way for any different reason. Oftentimes posture can make you feel a certain way, so it can definitely have an impact on your emotional and mental aspect, but also the physical. And so we're going to go into that as to how that can impact. So the benefits of ideal alignment, or basically ideal posture, is the top one here is that it does help with bodily position. So this is the basics. When your body is in ideal alignment and in a good posture, your organs can actually start to function as best as they are intended to. So the diaphragm, which is a muscle that goes beneath our ribs, they can move far more freer, and it helps with your lungs to expand and to contract as well. So more oxygen to the system, more oxygen to the cells and the organs, which helps everything to work more efficiently. Also, here, when you are standing at and sitting at an ideal posture, things become less compressed, specifically the stomach. And if your stomach is less compressed, then your digestion improves. So the organs of digestion are able to work the way how they are intended to. And then here we also know that, and this is a big thing for people who are working from home or have office jobs, that when you're kind of staying in the same position over and over again for hours on end, we tend to lead with our chin, so our head protrudes outward, and this actually impacts the blood flow to the brain. The other benefit with regards to having really good alignment and good posture is the big one that everyone's interested in, is the reduction of pain. So you can see in this picture here, so the ideal posture is the one on the left. And then the posture that a lot of people tend to take on, it's where they're leading with their chin. So their head is protrude outward, and you can see how the posterior neck muscles, they are strained and they have to work harder to hold the head back into alignment. And this can cause wear and tear on the tendons, ligaments, because you're constantly trying to support the weight of your head. And this can lead to muscle tension, spasms, and just really abnormal wearing of the joint surfaces.
Just to add to this slide is just basically what we're trying to do with posture, if you want to think about it, is the path of least resistance. So if my ear or my head ears are aligned with my spine, that means this is the shortest distance between my head and my uh, upper body cavity that the body needs to work against gravity. If you look on the picture on the right hand side, now the head is moved forward. That's one of the things that we call is the upper cross syndrome. That is partial picture of it. Now the fulcrum of this, that the body is going to tilt forward because of the gravity, and all the muscles in the back of the neck is trying to pull that skull, pull that head backward. That's when you get irritation to the muscle. And remember, as we talked before, the function of the muscle is to move object from A to B at a fulcrum point. It's not the function of the muscle to act as a ligament or as a support. That's when people start having tendinitis at the occipital base of all those muscles and the upper shoulder areas, leading to headache, even vertigo, And you mentioned all those, that the cluster headaches and spasm, all that kind of stuff that can happen with that bad posture.
Yeah, I think a lot of us are guilty of that posture sometimes.
Yeah.
Now, this was something that I learned when I was putting together this presentation, is that there is data, like, and it's not even that old really, new data to show that poor head and neck posture can actually be linked to increasing your blood pressure. So in that previous picture, when the person where their head was forward and their neck was at that weird angle, so on the right hand side, this basically prevents proper connection between the neck muscles and the brainstem, and then the base of the body um, increases blood pressure in response to that. So it's very interesting because you can hear, we always hear stories of people who've gotten into a car accident, they've had whiplash, or they've had some sort of neck injury, and all of a sudden they've got blood pressure as an issue. And this potentially could be an issue here of just having that poor head positioning and poor posture in general. The other benefits is improving mood. So when we talked about it earlier on with the quote, that there was studies shown that when somebody is seated upwards, their self-esteem, alertness, and overall mood actually improved. Whereas if you had somebody who was in a collapsed or a slouching position, this was actually associated with pain, depression, poor energy, and just overall higher stress ratings. And so, just like breathing, which we talked about several weeks ago, posture is something that you can work on for free, right? It's with you at all times, just like your breath. And it's just a matter about you being aware of it so that you can make certain adjustments, knowing that it can have an improvement on pain reduction and on your mood as well.
So this point is very critical. I've learned about it over maybe 12, 15 years ago. Is if I ask any one of the audiences here, can you mimic someone who's depressed and walk
Yes.
like them or sit like them? They immediately gonna slouch your head forward, you're gonna hunch, you bring legs together, both knees together, and you're gonna go almost like in that fetal position, but you're still sitting. And
Yes.
I've asked you, show me a position of someone who's happy, who's powerful. Immediately, you're gonna roll your back, pop your chest, open up your legs, open up your arms. That gives you that position of power. And so the interesting part is not about just mimicking those depression or powerful or joyful moment. Is scientists did correlate that when you do that, immediately you release endorphin to give you that high self-esteem, to give you that powerness, right? And if you look at it from even the animal kingdom, when an animal get forced, exposed to a fearful situation, the first thing they do, whether it's a bird, they bring their feathers out. The animals will bring their biggest posture. A bear will stand up on their feet. Basically, they defend themselves by putting more of an erect posture that gives them more of that powerful, position.
Taking up space, exactly.
Exactly. The more you can fill your space, the better you're gonna feel inside, and the less pain you're gonna have. And literally, as we said it before, those are really quick things that you can do. And people often told me before, well, that's silly. I can't be sitting in the office and doing that big posture move. Well, all of us go to the washroom, do it for 30 seconds, right? That's it. Do it in a cubicle, do it whatever you want to do, right? But the
Yeah.
idea is you want to, and take deep breaths in. Again, another one to think about it. Think about it when we start yawning. What do? We stretch our body backward.
Yeah.
Stretch our arms, we open up our arms. Look at people that play sports. When they score a point, they jump and open up their chest. So I want you to think of that movement always. Roll your shoulder back, open your chest. That's going to give you that grandiose position. That's going to give you the position of power. That's when you have the reduction in the tension of the muscle and tendons and ligament, which in turn reduces your pain.
Yeah, I really like that because in Chinese medicine, the act of yawning, we interpret that as we say that it's clearing obstruction so that qi, which is the vital force, life energy, can flow through the body. So when you're yawning and you are pulling yourself backward, you're actually opening the diaphragm, opening the outer aspect of your body to create more energy, create more flow. So yeah, I love that. Like in terms of helping your posture, thinking about taking up space, opening things up. Um, yeah, so many benefits there.
Oh, we went through
So
that. Yeah.
yeah,
So yeah, go. So this is one of the example we talk about on the left-hand side, which is the good posture. We get a feet. You basically are aligning your ears, your shoulder, your hips all the way one line. The upper one, the right-hand one, sorry, is called the cross syndrome, which is a poor posture. It's a forward head position. You can do the same with the back, but this is more common of the upper part of the body. An easy way to for you to align yourself, I do two techniques, and I do it with my kids too. I mean, they're 16, 14, and 12, and after this COVID, they become like hunchies, right? And like,
right,
well, yeah, they sit 7, 8 hours on the computer, and then the school, to be like proactive, they give them more homework, so they're sitting about 10, 12 hours on their chairs, right?
right.
So I say, imagine someone is pulling you from your hair. That's one. So that's how you're gonna pull your neck. And the second part is pop your chest, right? And
Yeah,
people would laugh at me. What do you mean I'm gonna pop my chest? Literally, pop your chest. If you're gonna pop your chest, you will naturally roll your shoulder back, and in turn, it's gonna roll your arms out, and it's gonna align your arm with your hips. Those are
yeah,
the only two movements. So one is rolling the chest out. Sorry, yeah, popping your chest, rolling the shoulders out. And the second one is to get the length of the alignment. And I often do it with patients sitting in the office on the chair. I put a mark against the wall and say, now give me your good position, good posture, roll your shoulder up. And they said, and no word of a lie, they increase their height between an inch
right.
and two.
That makes sense. Yeah,
So, but this is more visual. They saw it against the wall. Hey, I'm compressing myself, right? And of
right.
course, blood flow, breathing, mental status, all of those together, and you're compressing all those nerves, all those ligaments, tendons, and you wonder why we're having pain, right?
Yeah, yeah, seriously. So what you were talking here, so again, ideal alignment is to basically stand tall, straight, having the shoulders rolled down and back. On the next slide here, you'll see that it's kind of like labeled for you. So you want your head in line with your body, pulling your abdomen in. Now this be mindful of this. I'm also a pelvic floor therapist, and we don't want you tensing or bracing with your abdomen as you're walking or standing, because that can cause issues with the pelvic floor. But we just want you to be aware of some slight tension in the abdomen. Um, you want your feet shoulder width apart. So essentially, your feet are somewhat in line with the shoulders. And the key here, again, I work with a lot of pelvic pain patients. It is so important that you create a little bit of a micro bend into your knees. It is really common when people stand that they lock their knees in place. And so if you've ever seen those TV shows or in the movies where people are standing and a kid comes up from behind them and just literally very lightly pokes them behind the knee and the person falls flat. Well, if your knees were having that micro bend and someone were to poke you, sorry, there's a train passing by, you wouldn't fall flat if you had a micro bend in the knees. And the micro bend, when you lock your knees, you unintentionally create your pelvis in a funny rotation, which then sets everything else from the knees above in a poor alignment. So keeping that small slight bend. And so this took me like a solid year to learn because my habit was always locking my knees. So I initially started off with locking one leg, so one knee, but bending the other. And then when that leg got tired, I would switch. And I continued to do that until I eventually learned to just naturally have that micro bend in the knees. And then again, here you want your weight falling mostly on the balls of your feet, and you just want your hands to hang naturally at your sides. So this is sort of like a very, generalized way of how to get yourself an ideal alignment when you're standing.
So one thing to practice this, you start with a snowman position, lie down on the floor, and that's the alignment that you want. Now, when you move your hands like a snowman like when you do the snow angels, I want your elbows to be touching the floor all the time, including the wrist, and you go above your head. So that kind of trigger all the upper back muscle, upper back and neck muscle groups together to get that range of motion. Once you get comfortable with that and you're not lifting your elbow or your wrist or your shoulder, now you try to do that against like standing against the wall, but you can move probably about a foot from the wall, between your feet and the wall. Keep your bum touching, your shoulders touching, and your neck, the back of the base of the skull touching the wall. And try to do that position where you move your arms again. So that gives you the right positioning where you need to align yourself. And over time, you can bring your heels back together toward the wall. We're often too curved to do all of that all at once, and it's going to need some practice to stretch the fascia, the posterior chain specifically, because we're all curved forward, right?
Yeah.
It's more comfortable, and we need to work against that comfort.
Yeah, exactly. So on the next slide, here are some the common scenarios that most people run into. So obviously, if you're sitting down at an office setting or even at home doing work on a laptop or computer screen, we want the computer screen so that it's just below eye level. We want your feet planted on the floor. Your hips are in line with your knees. And your wrists aren't at a funny angle, because this is where we get a lot of carpal tunnel. But you can see here in the picture, the red picture, where the person's just hunched over. Like, it looks comical in the pictures, but this is reality for a lot of people. And if you get somebody to take a picture of you randomly when you're doing certain things, you can see how the posture can be improved greatly. What I think is amazing, if people have access to it, is to have a standing desk. This has eliminated, my husband actually, he was having really bad back pain at the beginning of COVID, and we purchased him a standing desk. So he uses it standing with a special mat on the floor. He does it for the first half of the day, has not complained about a back pain since, which has been phenomenal. So again, with at the standing position, again, making sure you're not locking your knees, if there is a micro bend in the knees as well. And walking, I am guilty of this, and it makes me laugh because I am so notorious for when I go walking. I walk my dogs twice a day. Whenever I'm walking, I'm literally, my head is down and I'm just looking at like 1 or 2 feet ahead of me, if that, 'cause I'm trying to scan to see what my dogs will come into. And the difference when you actually just elevate your head up and you're looking, half a kilometer away from you. Number one, the life that you can see surrounding you just like is amazing. But number two, you're not fatigued. Like, you actually feel, because your vision scape is expanded, you yourself mentally and spiritually, you feel a bit more expansive. And there's way less pressure on the head and neck happening when you are walking with your head in alignment with your shoulders.
That's awesome. Just back to the first or second position, is one of the most common causes for back pain and knee pain is sitting. Everybody thinks it's about overactivity or overdoing it. Well, I guess overdoing it by sitting too much or sitting in the wrong position. But literally now the society has shifted from, in school you spend most of your day sitting, you go to university, you're sitting, you you finish and graduate, you go to work, you're sitting, and everything is about sitting. And the problem is that's not what we're designed for. We're designed to
Yeah.
stand most of the day, walk most of the day, and sit a little bit.
Yeah. And this is the other thing that I have conversations with some of my patients where, we weren't evolutionary designed to, go do an intense gym workout session for 1 hour of the day and then basically sit at home doing nothing, or, being very sedentary for the remaining 12 or 10 hours of the day. So you're absolutely right. We are intended to move. The saying of the best posture is your next posture. Kind of rings true here. So here are some common posture pitfalls that people typically run into. Heavy purses, I recently, for several years, I would only walk around with a wallet. And then I most recently decided I should probably adult and buy myself a purse. But I made sure that I purchased a crossbody purse, because when you have a purse, even an empty purse, a small purse, what ends up happening is when you have it on hanging off of one shoulder, that will inherently cause the muscles of that shoulder to contract, so to tighten, and then to elevate upwards because it doesn't want the bag to slide down. And if you can imagine you're walking around the mall or you're walking around in that chronic position, you're going to get shoulder pain. I actually have one patient, she's a real estate agent, and she can't even have heavy sweaters on her body anymore because the weight of the heavy shoulder alone causes so much pain and discomfort in her upper shoulders and in her upper traps. And it makes me laugh because she's got this massive Louis Vuitton bag. And I'm just like, this is the thing that's killing you. But she doesn't want to give up the bag just yet. Again, so also carrying heavy bags and backpacks, this basically pulls down on the shoulder muscles and compresses them. And it's unnecessary weight that's happening there. So if you are going to wear a purse, make sure it is a crossbody. So you'll see the picture on the next slide. Actually, Mark, if you go back one, keep going back. Yeah, so on this picture here, on the right-hand side, wearing the purse across the body. So on the next slide, there is, the common issue here is having poor workspaces. So we do want to allow the height of the chair so that it's just high enough so that your feet can rest comfortably on the floor. If you have a chair that you can't change the height of, maybe placing a block or something underneath your feet so that your feet aren't dangling. This is a big key for low back pain here. Allowing your knees to be at or below your hips. Don't cross your legs. This is like a pet peeve for all pelvic floor therapists, because again, it just creates a funny, poor alignment in the pelvis. So if you do need to cross your legs, I always say, place the outer ankle on the knee so that you're kind of sitting in like an upward figure 4 instead of crossing it in the seductive pose, but just keeping it in that figure 4 positioning. That's a whole lot easier on the pelvis. If you need to, rolling a towel behind the lower back, again, having the monitor below or at eye level, having things just your head and neck in line with torso. But the key here is that we do want you getting up and moving frequently, right? So just because you're in a great ideal posture, if you're holding that for an hour, 45 minutes or longer, that's still not even ideal because again, you're just causing a lot of tension on the system. So, I will sometimes encourage my patients to have a tall glass of water at your desk space, encourage that you're drinking it. Every time you look at it, take a sip. Because what happens? Eventually, you're gonna have to go pee. And it's going to force you to get up and leave the actual desk itself. So again, moving is key here with any posture.
Just a couple of points about this. One of the key thing for me to get into that alignment is start with your bum first. Your bum has to wedge at the end of the chair. Once you do that, everything is going to align well because now you cannot lean forward. You feel like you're going to tumble forward. But if you wedge that where number 3 is, wedge your bum all the way back, no spaces, And now you're gonna see you're gonna be the L shape that you want it to do. And the other part, as you mentioned, you have to adjust the height, otherwise your legs will be dangling, and that's when you cut some circulation or feel some sciatica, district sciatica, paresthesia pain, because you're cutting or compressing on the sciatic nerve.
Yeah.
So just not, I don't want you to focus on this as a desk activity only. Car is a huge one of them. I like my seat to be at 90 degrees. If possible, if it's an SUV, if it's a sedan, you have to push it all the way back. And again, if I'm going and traveling for 4 or 5 hours, on the hour, I gotta walk for 5 minutes. Otherwise, you will hurt your back. And I know that from experience after my back surgery. My limit is 45 to 50 minutes, and I gotta stretch for about 5 minutes, stand, walk around, and before I can go back and sit on that chair.
Absolutely. Even for traveling, when you're on a train or when you're on an airplane, like you do need to be getting up and moving for sure. So tech neck, unfortunately, my God, we have come to a place in our evolutionary creation where this is an actual term. So this is obviously with the invention of the smartphone, where we're constantly looking down on our phones. And this again puts our head in that very forward motion. And it's causing all of the neck muscles to work really hard to kind of keep your head from, snapping off your neck. So it's working really hard and it's creating a lot of tension to hold you in place. And so ideally what we would like is that when you are standing and using your phone, to hold the phone as close to eye level as possible. So your arm is doing the work instead of those vital neck muscles. Or if you're sitting upright and using arm rests or pillows or a desk to support the arm so that you can look at it. I'm right now, I have a special sort of like, and you can buy these anywhere on Amazon as well. They're like these little arms that are attached to my desk and they can hold my phone. And I essentially just have it on my desk and it's at eye level. So I'm not having to push my head forward. And when I say head forward, something that I train myself to do is, as women, we never want to have the double chin. But it's helpful to kind of remind yourself when you notice that your head is drifting forward to say, okay, I'm going to give myself a little double chin. I'm going to push my chin inwards, and that just helps to lengthen the back of your neck muscles. So your next steps. So if you are curious about sort of where your posture is and you want to try this at home, you're going to stand with your head and shoulders and buttocks touching a wall. And you're going to want to have your feet roughly 2 to 4 inches away from the wall. And you're just going to want to slide your hand behind the curve of the low back. And you want your palm flat against the wall. Now, you should feel about 1 hand thickness of space between your back and the wall. Now, if you have too much space, you're going to sort of engage your abdomen, and this will actually naturally flatten the curve in your back. If you have too little space, so if you try and slide your hand behind there and you can't really get there because there's not enough arch, you want to arch yourself back so that your hands can fit comfortably behind you. And you want to sort of, create some muscle memory there so that when you take a step away from the wall, that's kind of that's the natural ideal standing posture. When you do this, it's going to feel funny, especially if your posture and alignment is really out of whack. But keep coming back to this test to kind of remind you to create that muscle memory to know what is the proper alignment for you. And yeah, so we've already covered this. And so the next steps in this slide is something that we had in the previous, so in the 9th series, talking about walking. And walking can even be seen as a posture or alignment because again, it's that movement aspect. So in a utopian world, we would love everybody to be walking 10,000 steps a day. And this can be monitored on either a smartwatch or on your smartphone, or you can go to Winners or any sort of like sports store and pick up a pedometer. Um, Now, before you jump in and try and hit the 10,000 step goal every day, you need to monitor and see what your baseline is. So, wear the pedometer, wear the smartphone, get an average for where your steps are on a daily basis. If your average steps are 1,500 a day, then, for the next following week, increase it by 200 or 300, and maintain that. Try and crush that goal every day. And when you feel confident that you can easily do that, you want to increase that by another 300 or maybe 500 steps. Eventually, you'll get to that 10,000 steps. I know personally when, I think is 9 or 10 years ago, I had a patient with type 2 diabetes, diabetic neuropathy, which basically means nerve pain in both of his feet. And he was wearing his Fitbit. He was averaging about 2,500 steps a day. And he actually inspired me to get a Fitbit. So I got one. And I remember thinking, I probably am walking like 7,000 steps a day easily. And my average was 1,500, which basically meant this 65-year-old male with type 2 diabetes and nerve pain chronically was crushing me, like he was beating me. And so for me to go from 1,500 steps a day to 10,000 steps a day, that took me about 7 months to get to that goal consistently. And that was, I'm in my early, oh, not my early 40s, but I'm approaching my 40s. And this was when I was in my very early 30s. So be patient with yourself, right? Don't jump into the deep end too quickly.
One thing I'd like to add, I'd rather than going to 5 or 6,000 step, I'd rather if you can focus a combo on, can I do those steps with a proper posture? So let's
Yeah.
combine 2 or 3 things together. So instead of doing 3,000 steps a day, I'd rather if you do 1,000 step, but with a proper posture. And now you can focus on your breathing and the meditation technique at the same time. So
Yeah.
as you build forward, it's not about just the number, it's the quality that count as well, right? Because some people tell me, yeah, I walked to 10,000 steps, but I'm in a lot of pain. Well, because either you went too fast, or you are really hunched forward,
Yes.
you put strain on your hip, on your neck. So it defeats the purpose. It's not the intention is the 10,000 K, it's the quality of that 10,000 K. And if you can get 2,000 of it, that's awesome. You get 3, that's awesome. So try to incorporate the 3, the walking, the posture, and the breathing. Incorporate all the 3 together.
Absolutely. And so I'm not sure who said this phrase, but it's true that the best posture is your next posture. So again, no matter if you are, if you figured out what the ideal alignment is for you, but you're locked in that for, an hour plus or more, it's important that you constantly are moving your body. Um, Now, with regards to what we do here at Arthritis VIP, one of the things that you'll notice in the program to help with tissue repair and decreasing inflammation is a combination of MSM and glucosamine. So the combination of the two, they're incredibly anti-inflammatory. They can reduce acute and chronic pain associated with osteoarthritis. And when taken over a very long period of time, it can help to stimulate the formation of cartilage, which helps with the joint repair that you're trying to do as you're improving your alignment, as you're improving your posture. And then our famous slide here. I'll let Dr. Mark take away with this slide.
So back to that model that we always talk about with new patient, existing patient, returning patient. We work on the 3 biggest element of that decline health and causes arthritis, chronic pain, musculoskeletal pain, is the physical stressors. And we start with the injuries due to whatever reason. Overuse, that's rarely the case with our society now, unless you're really an athlete, marathon runner, do other really strenuous stuff. But most of it is really related to what we do with our poor posture and sedentary lifestyle. And that will put a lot of strain on those ligaments and tendon that we talked about with what we saw with the neck forward carriage posture with the neck being forward. And those people, when I see them in the clinic, those are the people that come with neck pain, headaches, migraine, that kind of stuff. And it's just basically correcting the posture. The problem with it, when you start correcting the posture, you feel that your body is resisting you because now you're trying to align something. The body got used to the bad habit, right?
Yes.
And so, other than what we do and what you do, that's when we kind of interfere with all the modalities that we have, whether it's a shockwave therapy, prolotherapy, PRP therapy, try to help boost the healing in those ligaments, tendon, and or the cartilage. And we've talked about the chemical stressors before, the emotional stressors, but the idea if we can incorporate things together. So if we're talking about posture, if you look at it with the second one, the chemical stressors, when you open up your system, now you're going to have better blood flow. So basically, you can be able to eliminate toxins. You can be able to absorb the nutrition that you're eating. In terms of the emotional stressors, when your posture is aligned, you're able to do those 5 to 10,000 steps. Now your quality of sleep will improve because you've been helping to circulate that blood flow throughout your relationship, because now you're going to feel happier. You feel that you're achieved, right? So it's all interlinked together. It doesn't matter where you start, but you need to start. And we're here to help you no matter what pathway you want to take, but eventually you're going to reach to you have to fix all the three to get better.
Yeah, absolutely. And I think that's what sort of sets Arthritis VIP. The model is completely different because you're getting kind of like patchwork piecemeal information, and you're not really addressing these three key components to your health. So yeah, follow this and you will definitely see some improvements.
Awesome. So any questions or comment, if you have them today, you can ask us. If not, you can send them through our phones or emails, and we're more than happy to answer those for you. That will take us to a conclusion of today's session. I do thank you very much, Crystal, for your presentation and insight, and we'll connect in the next 2 weeks with the next episode.
Sounds good. Thank you. Thank you for having me. Yeah, and
Awesome.
we'll chat.
Great night,
Take
everybody.
care.
Take care. Bye.
Bye.
Thank you. Good night.
Good night, Jen.